In this virtual visit, in terms of the virtual ASCRS meeting this year, we're joined with Julie Speed, who is the Chief Commercial Officer at Eyevance Pharmaceuticals. Welcome, Julie.
Thank you, Cheryl. Nice to see you.
I guess let's just kind of jump right in, and I would love to just talk about some of the products in the pipeline. Let's begin with the launch of the new treatment for ocular itch. Could you speak more about that?
Yes, indeed. Of all times to be launching a product, we launched Zerviate just a few short weeks ago. So Zerviate is actually formulated with Hydrella. It's a product that we have now available with the active ingredient cetirizine. So many of you may be familiar with that with Zyrtec. So in essence, it's Zyrtec for the eye with Zerviate. And so it's extremely comfortable and very safe for patients. But again, exciting time to be able to get Zerviate out. A lot of confidence so far and a great experience with the product.
So was that part of the virtual exhibit at ASCRS?
Yes, and so one of the things we wanted to make sure of as well, obviously we didn't have the chance to do this live, but again, the intention there was to be able to make sure that people were aware that now Zerviate's being available. It's been a long time since we've had a new molecule out that's been approved for ocular itch for allergic conjunctivitis. So certainly was a feature of what we wanted to talk about there at ASCRS, as well as our second launch with Tober Dex ST.
And speaking of that, why don't we talk more about that then? The second launch that you were just talking about.
Yes, and so Tober Dex ST may be a familiar brand for many of you. We are now launching that, and again, the really differentiating feature, which I think many have forgotten, but we want to get top of mind again, is why Tober Dex is different from Tober Dex ST. And really that component being around Xangen or xanthan gum, which is the drug delivery technology that's allowing higher retention time for the product on the ocular surface. So it's been received very well, especially for blepharitis patients and such, and one that we're excited to have in our bag and really round out our portfolio of products for the ocular surface.
And what is unique about the suspension technology?
The fact that it's able to, again, increase the retention time on the ocular surface has allowed us to actually have half the dexamethasone in the formulation as well because of that increased retention time. So increasing concentration, therefore increasing the viability and the bactericidal activity of the antibiotic as well as the anti-inflammatory component. So again, the Xangen giving the kind of drug delivery technology piece that's novel, new, and materially different from Tober Dex is exciting, and one that is proving out to be quite successful and has great data to back it up.
And are there any other products either in development or commercially available that you might have updates for?
Yes, we have another product which we've recently acquired as well, Nadicin. Many of you may have used this in the past as well, but again, to treat fungal infections on the ocular surface, Nadicin is available by prescription, and one in which is available to anyone to use now. So versus needing to go to a compounding pharmacy, Nadicin is available for those fungal infections on the ocular surface.
It certainly sounds like you have a very robust portfolio, a lot going on in the ocular surface right now. What are you most excited about?
I would say just having a rounded out portfolio, for those that may have, talked to Eyevance maybe at AAO, I think it's maybe the last large meeting that we've had all together. We all had Flarax and Fresh Coat PF, and now knowing that we have a much more well-rounded portfolio, adding to that portfolio, looking at comprehensive offering for the ocular surface now with something for allergic conjunctivitis. We've got obviously Flarax, a mid-potency steroid that doctors can use for a broad number of indications for inflammation associated with the ocular surface. And now, again, Tober Dex ST and Zerviate, so a new novel product. Our mantra really has been we want impactful and innovative products, and I think we're delivering on that promise. And certainly, more products to come in the pipeline. But for what we have available now, again, a broad range of products focused specifically on the ocular surface.